से तकलीफ होता है,
चलने या खड़े होने से
खड़ा।
बहुत सारा खिंचाव होता है।
छोड़ दो, ऐसे क्या होता है तो छोड़ दो। सिर उठाओ, नहीं होता है सिर।
वहाँ पे टेंशन
ठीक है, बस बस।
अच्छा, ऊपर
I've implanted an intrathecal baclofen pump for her in the anterior abdominal wall with a tube that is going into her back, and which is this pump has a tank capacity of 40 ml, and inside which the drug is placed, and that drug at a pre-programmed rate is delivering the drug through this spinal cord tube into a particular space on the spinal point on the spinal cord, which I have determined and kept the tip there. Alright, now this can be programmed, adjusted to as per the patient's requirements and needs. Normally we give a standard continuous dose for 24 hours. This is at micrograms per hour. Normally the drug is given milligrams in the orally, but somehow doesn't work because 90% of the time the drug doesn't cross the blood-brain barrier, which is like a checkpost in the brain. So now what we have done is, in her case, she is fine the whole day. From 9 o'clock in the night till 5 o'clock in the morning, she has some problems specific to that time, which involves tightness of the leg, lot of pain in the leg, and difficulty in turning in bed. So this programmer is designed, and the pump is designed in such a way that I can give additional doses at that particular point of time as per the patient's need. So what I have done today is I have done a flexi program where I can give extra doses at the times that she needs it, so that she is as comfortable as possible around the 24 hours. So I'm now going to, if you see here, she's got a baseline dose going here, and she's got two bumps here. One bump is for the early morning from 12 o'clock to 5 o'clock in the morning. Other bump is from 9 p.m. to midnight. So she needs this extra dose because she's getting tightness in the night when she's sleeping, some pain, difficulty to turning to the sides and things like that. So we are trying to see if we can program it precisely at that time, so that discomfort goes away. So done, confirm. Both have become the same height. So I've increased our dose now. When I go next.
Come on, come on, come on. 5. Count பண்ணுங்க 1 2 3
I should thank Sir Sharan Srinivas. Srinivas, I always pray Lord Balaji only. It's my favorite God, I can tell. I see doctor as God only. Ante.
Oh, she's saying go.
Okay, can you play this? ये क्या है? पूरा करो, चलो, पूरा करो.
Redefined.
1 इसे लो वापस लो 2
Okay, can you show me your left hand? Yes. Okay. Nina, can you show me watch? Good job.
Nina ma'am, what are you wearing?
I wear 90.
You're wearing nighty.
I wear 90.
Good
Wear
job.
90.
So Nina, you said today is 22nd, no? Yeah. So which day is it? Okay, correct. It is Tuesday. बोलो तारारारा.
Like a rare case of black fungus going directly to the brain was reported from Bengaluru, and given the symptoms, it was at first considered to be a relatively more common post-COVID stroke. Fortunately, the woman patient was successfully treated. Maya Sharma has
Variations. Joining us, Dr. Sharan Srinivasan, a neurosurgeon of the Bhagwan Mahavir Jain Hospital here in Bengaluru, and his colleague Dr. Sridhara, a neurologist. They came across a very unusual case recently.
Yeah. So we had one patient, 48-year-old female. She was having mild COVID symptoms like sore throat. She was admitted in local COVID care center for around 8 days. She was treated with simple medications, and she was not on any steroids or any supplemental oxygen. Patient was discharged. After discharging, patient developed acute onset right upper limb and lower limb weakness with speech difficulty. So nowadays, post-COVID, many patients after recovering from COVID, many patients are having ischemic strokes. We thought of stroke. As a detailed evaluation, we did MRI brain. For our surprise, it was not looking like a classical stroke. So there was a doubt regarding whether it is a tumor or abscess. So it was a region of thalamus area inside the brain. So because it was not like a classical stroke findings in MRI, we requested our radiologist, we discussed with our radiologist also, and they also opened like it is more looking like a tumor or abscess. So it was a very deep-seated lesion, which requested our neurosurgery team to take stereotactic biopsy, because histopathology is very important.
Said there was no mucor in the sinus, there was no mucor in the eyes. And when he referred the patient to us, the question was really, should we biopsy? How do we reach this lesion, because it is very deep inside the brain. So the stereotactic MRI guided stereotactic procedure was the procedure of choice that we decided. Patient was quite restless, and because of which we had to delay surgery by a day. And then what happened was, we had to fix a special frame to the head, like we did for the guitar surgery in the past. We put 2 screws on the front, 2 screws on the back into her skull, take her for a special MRI. And then these are the MRI images. If you can see at the back of me, you can see these are the 3 different images of the brain. This is the axial section, this is the coronal section, and this is the sagittal section. And we have to go all the way inside here. This is a journey which is at least 10.5 centimeters inside her brain. So we really did not think of Mucor as the first line of diagnosis at all, because she had no other features of that. So when I went in and actually hit the abscess and aspirated with the syringe, there was pus that came out with a little bit of blood stained, combination of that. So we sent it for the biopsy and the histopathology and the microbiology. I'm telling you very honestly that we did not think of Mucor to the extent that I did not even ask for Mucor in my test. It was thanks to our senior microbiologist, Dr. Geeta Bhatt. When she was peering under the microscope and she looked at it, she said, "Ooh, this looks like Mucor and not like TB." Thanks to the surgery itself, her weakness improved, her speech improved, and she has 2 small children, young, teenage children who are very anxious about this, and they were extremely happy to see that the mother started, talking to them, and it sort of, got much more brighter after surgery.